First of all, I would like to say it's a pleasure being here with all of you. I will tell you about the pathways to ulceration, and then I will expose you a case report. Diabetes is a chronic metabolic disease characterized by elevated levels of blood sugar, which leads over time to serious damage to the heart, blood vessels, eye, kidneys, and nerves. 422 million people worldwide have diabetes. In 2035, will be almost 600 million people worldwide with diabetes. That will be considered as a pandemic. Okay, where does the bad metabolic control take a diabetic patient? Okay, first of all, the metabolic syndrome is the sum of elevated levels of glycated hemoglobin, dyslipidemia, cholesterol, hypertension, and visceral obesity. The metabolic syndrome takes us to a long-term diabetes complications, which are the retinopathy, nephropathy, neuropathy, and arteriopathy. So, the diabetic foot syndrome is the sum of a metabolic syndrome, arteriopathy, and neuropathy. According to the WHO and the International World Group of Diabetic Foot, diabetic foot is defined as the foot of diabetic patients with ulceration, infection, and or destruction of the deep tissues associated with neurological abnormalities and various degrees of peripheral vascular disease in the lower limb. The cost of an amputation in Europe is about 40,000 euros. In the USA, is over $70,000. In Europe, the cost is about 11,000 euros patient years. In the other side, in the United States, is about $9,000 for patient year. It's important to say that healthcare costs and mortality rate are similar than cancer rates. Now, I would like to talk about a case report we have in our diabetic foot unit. Okay, the case was a 54 years old male with the next clinical history. Diabetes type 2 since 2003 in treatment with oral anti-diabetic drugs, rapid-acting insulin, and long-acting insulin. The glycated hemoglobin value was 12%. He also had dyslipidemia and elephantiasis disease. The body mass index value was 54. He had also an amputation history of the second right foot toe in 2005. And finally, his job was a truck driver. The reason for the visit was the right foot. As you can see in this picture, we can see the left foot. Now you can see the right foot. Okay, as you can see, the left foot had multiple infected ulceration, and the left foot had a typical neuropathic ulcer, the right one, sorry. Both of them of several years of evolution. Also, as you can see in the X-ray image, the patient had a multiple bone fractures and destruction. What was the treatment plan? Okay, first of all, the patient was evaluated by all service in the diabetic foot unit. Then the patient required hospitalization for intravenous antibiotic. It was decided to realize a left limb infracondylar amputation due to the infection gravity. We treat the right foot ulcer with a topical treatment with Urgostar Plus every 48 hours. After the hospital discharge, the patient needed a weekly follow-up in the diabetic foot unit. Okay, in April 2019, the body mass index value was 50. The glycated hemoglobin was 8.5%. The patient accepted to submit bariatric surgery, but you have to know it takes more than a year of waiting list. The patient was in a strict control by the diabetes education nurses, We continue the treatment plan with the right food. As you can see, the ulcer decreased considerably in size. The patient was waiting also for the placement of the leg prosthesis. In January 2020, before COVID, the body mass index value was 48. The glycated hemoglobin low at 6%. So it means a normal value. Rapid-acting insulin was eliminated of the treatment, and the patient started a normal walking with a prosthetic limb. In April 2022, after COVID, the patient lost 25 kilograms since the bariatric surgery. The orthopedic surgeons proposed a first metatarsal elevation osteotomy surgery, but the patient refused it due to the belief that it would hinder the weight loss process. So we decided to continue a conservative treatment with offloading boot. Now I'm going to read the conclusion of this case. First of all, poor metabolic control in a diabetic patient can lead to the development of a diabetic foot ulcer. Although amputation should be considered as a failure in the diabetic foot, in some cases they should be considered a shock treatment. Multidisciplinary care in the diabetic foot units is the best option to treating this type of pathology. And the last one, the biopsychosocial status of the patient must be considered when making decisions during the entire phase of the treatment plan. That's all. Thank you so much for the attention.